Hello, so this video is how to keep your medical records organized and why it's important. So, gone are the days when people kept their family physician past childhood through young adulthood and parenthood and into old age. Now, most healthcare consists of an assortment of primary care physicians and specialists, supplemented by visits to urgent care clinics and emergency rooms. Unfortunately, that patchwork of healthcare often comes with a disorganized collection of medical records, to the point where it's unlikely that any one doctor knows a patient's entire health history. That means it's up to you to provide that history. And no, you don't have to track down your old physicians. He or she probably doesn't even have your paper records anymore. If your doctor is one of the many who have switched to keeping patients' records digitally, the task of compiling your history will be easier. There are two kinds of digital records: electronic medical records and electronic health records. An EMR is a digital version of a records individually doctors keep. It's like your doctor's old medical chart, but now on a computer. EHRs are designed to help share information among doctors and hospitals and with patients too. Since January 1st, 2014, all public and private healthcare providers have been required to adopt and demonstrate meaningful use of EMRs in order to maintain their Medicaid and Medicare reimbursement levels. There were additional incentives for healthcare providers who adopted EMRs. Excuse me. There are clear benefits to electronic record keeping, besides eliminating the health ache of paper files and making it easier to share information. Digital records may save lives, explains Leslie Kadlick of the American Health Information Management Association. Emergency room doctors no longer have to waste time dashing to the records department for the chart of a patient who was just admitted. They can simply call it up on the computer screen. There are stumbling blocks, however. For starters, because EHRs are a recent phenomenon, everyone has a medical history of appointments and treatments that occurred before digital records existed. It's also surprisingly difficult, given the ease with which other information is shared online, to swap records between your primary care doctor and a specialist office if they don't use the same EHR system. Compiling your history may still mean contacting many different providers. So this is a list of things that you should have for yourself and where you can get it if you don't. So one of the things you should keep in your health records is a list of all current meds. Keeping a list of what you've been prescribed plus anything else you're taking. It's important for a doctor to know everything a patient is taking, including vitamins and supplements. They may interact with prescription drugs. If you see different doctors who prescribe meds without consulting each other, they can refer to your list before making any new drug recommendations. So where to get it? Start by writing down, typing up, or photographing the labels of your current prescription meds, including drug name, dosage, and instructions. Contact this prescribing doctor for any missing information. Then add to the list any vitamins, supplements, and other diet, nutrition, or weight loss aids you take. So the next thing on this list is a description of your chronic medical conditions. If you've had care for any ongoing health problems, such as asthma or diabetes, you likely tried several treatments. It's helpful for your doctor to keep track of what you've already tried, what's worked or hasn't worked, and what kind of progress you're making. So where to get it? If you received your diagnosis within the past 7 to 10 years, those paper records may still be available. But if your diagnosis was made before that, your doctor may have discarded them. In these cases, do your best to recall the early stages of your condition and treatment, and write down what happened. Consult other doctors who have treated you since then to obtain your records. So the next thing on this list is a log of past procedures, making sure your physicians understand what kind of medical procedures you've had in the past can affect your future treatment. If you had a mastectomy, for example, your doctor will tailor ongoing breast cancer screenings to your personal history. If you had several cancerous moles removed, a doctor will want to keep a close eye on other suspicious spots. Way to get it. You probably remember big surgeries and procedures, but if you're unsure, consult the insurance companies you've used. They should be able to provide you with a list of treatments and procedures doctors billed them for over the period you were covered. Okay, so next they have a copy of recent test results. The results of cholesterol, blood sugar, blood pressure tests provide a baseline for any doctor to get quick insight into your overall health. So where to get it? Request a copy for the past 2 years' blood work and screening results from your most recent physician. Oh, I know, I'm talking. It's okay. My kitty wants to cuddle on me. Anyway, a list of immunizations. A lot of patients have no idea what vaccinations they've had. Way to get it. Contact your past physicians to see what's on your record. Your family history. Your family medical history can play a big role in indicating whether you should undergo early screening tests for conditions such as heart disease, diabetes, and stuff like that. So way to get it. Talk to your family members about their past problems. This might not always be a cheery conversation, but it could save your life. So how to organize your health records. There's many different options here for that. One says go digital, type up a list of your medications, vaccinations, family histories, and scan copies of imaging and other test results. Or step of paper. If you're more comfortable with paper records, you can get a binder. Keep the essentials. How long to hold on to medical records varies from person to person. You should keep information about treating your lifelong allergies, for example, but you don't need decades worth of blood test results. Stay up to date. Once you've compiled your medical history, keep your record up to date by adding to them each time you have a doctor's appointment. This content is created and maintained by a third party. I didn't do it.